Theme 1 tries to answer the question, how can we best innovate in healthcare? And we're looking at 3 different projects in Theme 1. One is around early intervention in psychosis. Often in healthcare you'll have adult services and child services and problems at those interfaces when people grow up. They're too grown up to be a child, but adult services don't receive them as an adult, and that's a problem that they found in mental health. And Professor Lennox leads a theme project around early intervention in psychosis that's age independent. It's a way of overcoming that. Jane Fossey leads a project looking at care homes and how to improve the care that we deliver for both mental and physical health in patients in care homes, particularly those with cognitive impairment. My project on the emergency multidisciplinary unit is answering a question about delivering care to a patient group that is typically older, living with frailty, and face a number of challenges if they're put into an acute hospital bed during delivery of acute care. And we're looking at patients who are perhaps well enough to have an out-of-hospital care paradigm delivered, but they're still complex and living with significant frailty and dependency. And we're trying to work out, are there similar methods across all these 3 quite different questions that help us distill out what is it that's innovative, how do we evaluate it and assess it, and accelerate the innovation in care that we have in the NHS. What we don't yet know is the effect that we have on the experience that patients have. And we as researchers and clinicians want to improve the experience of illness and recovery for patients, their families and carers. And we're not going to do that, I think, until we understand more about care through the eyes of the patient, families and carers. I think the CLAHRC needs to be thinking very carefully about how it links up all these innovative projects that are now being funded by NHS England in order to understand how we can deliver quicker answers about what works and what doesn't. And that would really help commissioners, it'll help healthcare providers, and more importantly, it'll help patients.